The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Kempthorne Motors, Kiko Auctioneers and Realtors, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and our special guest, Dr. Stephen Kelly, general surgeon from Altman Medical Group, General Surgery. Thank you for joining us this morning.
It's great to be here.
Robotic surgery is a type of minimally invasive surgery, which means that instead of operating on a patient through large incisions, mini-sized surgical instruments can fit through a series of quarter-inch incisions are used. Robotic surgery, or robot-assisted surgery, allows doctors to perform many types of complex procedures with more precision, flexibility, and control than is possible with conventional techniques. Today we're going to learn about this and what it could mean for people who need to have surgery in the future. We'd like to remind our listeners that today's program is available on our podcast, which can be downloaded from the App Store on your favorite mobile phone. You can look for Health Matters with the Medicine Center Pharmacy and listen to any of our programs anytime, anywhere you go. If you have questions you'd like during today's program to ask, you can either post them up on our live Facebook feed or you can give us a call here today at the radio station at 330-450-1480.
So, Dr. Kelly, can you tell us a little bit about your background and about yourself and where you practice?
Sure. Well, first of all, I'm a homegrown guy. I was born in Perry Township, was raised there. My wife as well.
And you came back?
And I came back.
Okay.
Best decision I've ever made.
All right, cool.
Did my training at Case Western Reserve in Cleveland, stayed there for my residency, and then spent 4 years on active duty as a surgeon in the United States Air Force.
Oh, okay. Now, where all did they take you?
Well, my first duty station was in a little town in South Georgia. I was at Robbins Air Force Base. Okay. Very nice little southern town. We loved it down there. We were so small, though, that they closed our operating room, and so I was there for 2 years and then left. I was transferred to Wright-Patterson. I was there as an overage, so once I got to Dayton, I got the opportunity to kind of go to some other places in the world and support some combat missions.
Well, is there a hospital at Wright-Patterson?
There is. There's Wright-Patterson Medical Center.
I didn't know that. Okay. Huh. And you got to fly out?
Got to go to some interesting places. I'll just leave it at that.
That's good, Al. We're not going to hear. Okay.
Well, thank you for your service.
Thank you. You're welcome.
Yeah, that's great. Just great. Thing in the paper today where they just moved the Memphis Belle to Wright-Patterson.
Oh, did they really?
It's hanging in the ceiling of one of the hangars, I guess. It's in a repository today.
You know, in my military experience, I got to meet and interact with some fantastic people. I actually took care of one of the crew members that was on the Enola Gay support group.
Wow.
So you get to take care of some history. So it was a very rewarding part of my career.
What was his position on the plane?
He was a maintenance guy. Did some mechanic work.
Mm-hmm. You know, growing up, I heard all kinds of stories how the pilot of the Enola Gay killed himself because of this, what he did. Of course, he lived a long life.
He did, yeah.
And it hasn't been too long ago since he died.
Passed away, Paul Tibbets.
Paul Tibbets, yeah. Oh, interesting. So how long have you been in general surgery?
July 1st will mark my 20th year.
Wow.
Graduated from my residency training program at Case in July of 1998.
Okay.
And went on active duty, and I've been back home here in Canton since 2002 in the same practice.
Very interesting. So what types of procedures do you perform?
Well, in our group, we're pretty comprehensive general surgeons. And the term general surgeon kind of is a misnomer. In the old days, general surgeons did everything. They did hysterectomies, did vascular surgery, chest surgery. We're now primarily confined to the abdomen, so gallbladder surgery, hernia surgery, colon cancers, bowel obstructions. We also take care of a large population of patients with breast cancer.
Okay, interesting. So what's new and exciting in your practice?
Well, since December of 2016, I've been using the Da Vinci robot for a lot of my surgical procedures. It's been a big change in my practice and career. 20 years in now, so it was a big challenge, and great thing for me to kind of embrace that new technology. And
so you had to go back.
Had to do some retraining. The training process for me it was about 6 to 7 months, starting with simple things like video review. I went and saw several surgeons and did some case observations, did some formal training at Ohio State, and then through the industry, they have a formal training program that each surgeon's required to complete to make sure that you are safe. And then you have several proctored cases where another surgeon comes and kind of is there for assistance and looks over your shoulder as you're kind of getting proficient with the new procedures and the new technology.
Is it safe to say that there's only a few places in the country where you can get that training?
There are 3 training centers, one in San Francisco, one in Houston, and one in Atlanta, and they're all supported by the manufacturer.
I see. Where'd the Da Vinci come from, the name? I've heard the Da Vinci Code.
The company, they name their products different. In this iteration of the robot is just called Da Vinci. I don't know the background of why they chose that name, but this is the Da Vinci robot that we have. There's about 1,200 hospitals just in the United States that have Da Vinci robots.
Wow.
At their world headquarters, they have a map of the world, and they have a magnet representing every robot that's out there. There are robots in Aruba and some great place in Bermuda has a robot.
Well, interesting. So, how long has this product been in the market?
Product's been in our market for some time. The general surgeons have kind of been late adopters, but the first specialty to really embrace robotic surgery were the gynecologist and urologist. Their data showed better patient outcomes, safer surgery, less blood loss. The general surgeons were kind of behind the time because we relied on regular laparoscopic surgery for so long that I think we were not on the first wave of early adopters. But general surgery, robotically, is the fastest growing component of robotic surgery. The cardiothoracic surgeons are now using it for lung resections and to assist them with some of their cardiac procedures as well. And we're able to offer that here in our community.
We had an interesting discussion before we came on the air about new surgeons coming out of all their sort of trainings, and apparently they're not teaching general surgery with a scalpel and knife anymore.
Well, the training has changed. I'm mid-career. I've been at this 20 years, and I'm sort of a dinosaur because I trained in a different era. I trained in an era where most surgeons were trained to do open surgery exclusively, and I was in that first wave of trainees that went through laparoscopic training. As our ability to do more and more procedures minimally invasively has progressed, some of the open procedures are still being taught. They're just not being done as often, and so the repetitions as you train are a little bit different. So our technology really is a double-edged sword. I think surgeons still have to be proficient both at using technology but also doing the old traditional open procedures, because that's going to be your bailout if you run into trouble.
What do you see in the future?
Boy, that's a loaded question. I think overall we'll be doing less surgery because I think we'll be able to harness disease and debility, through gene manipulation and through medication. And I think there'll always be a place for a general surgeon, but I think that our touches on the patient probably will be less and less, and they'll be more minimally invasive, which is good for patient outcome.
Where does it put the surgeons?
In a unique position. Will always be needed, but I think our roles in the future will change.
Oh, interesting. I guess all of our business has changed dramatically too, and I've been in for 50 years, and it just isn't even a picture of what it was.
Look how pharmacy has changed. Look how the technology of just producing the show has changed.
Yeah, for sure. So, tell us what exactly robotic surgery is.
So robotic surgery is really a technology platform. If you think of an operation done 20 years ago, a hernia repair, say, or a gallbladder, that was done through a fairly large incision. The next phase of technology was laparoscopic or minimally invasive surgery, where we are able to do the same procedure through smaller access incisions. The visualization is two-dimensional. The equipment has 3 or 4 degrees of movement. Robotic surgery has just taken that to a different level. We now have 3D high-definition visibility. The instruments are wristed, so they have 7 degrees of freedom, so I can do anything with those instruments that I can do with my hands and my wrists. The next phase will be they'll have not only wrists but elbows, and we'll go from having multiple access points on the patient to probably a single site access point. So the technology is constantly changing, which really keeps you sharp. Some patients think that a robot is going to be doing their operation, but it's really the surgeon is controlling the technology. I'm about 4 feet away from the patient sitting at a console, but all the instrument movements are controlled by the surgeon.
Oh, interesting. Have we upgraded this equipment since it first came out?
We have. The manufacturer's on their 3rd generation of robot. In our community, we've gone through the 1st generation robot. Then 2 of the hospitals had the 2nd generation, and in both Mercy and Altman have the latest generation of the robot. It's called a Da Vinci Xi. So we really do. We're lucky in our community that we have access to some of the best technology in the world.
Fantastic. Okay, doctor, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
You won't want to miss the upcoming Kiko Absolute Auction, May 23rd, with auctioneer Bill Gill Jr. You'll find a variety of Lionel trains, LGB trains, and Thomas the Tank engines, all from one private collection. You'll also find toys, including a pedal fire engine, G.I. Joe B.O., Jeep, a 3-horse carousel, John Deere die-cast tractors and trucks, coin banks, and more. Mark your calendar for this Wednesday, May 23rd at 3 p.m. at 3201 Parkway Street, Northwest in Canton. Call Bill Gill Jr. at 330-418-8727 or visit Kiko Absolute Auctions for pictures, directions, and more information.
Spring has sprung at Studio Arts and Glass with our annual Garden Art Show, June 8th and 9th. Local artists fill studio with pottery, jewelry, blown glass. Watch our craftsmen create beautiful stained glass windows or make a succulent live wreath. Call to reserve your space today or just come in for the Killer La Pizzeria Brownies. That's Friday, June 8th and 9th from 9 to 8 p.m. Studio Arts and Glass in North Canton on 77 and Apple Grove.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking with Dr. Stephen Kelly, General Surgeon from Altman Medical Group General Surgery. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed.
All right, we've been talking about robotic surgery, and it's pretty impressive, some of the stories you've told us so far, Dr. Kelly. For those just joining us, can you tell our listeners what kind of robotic surgeries can be done at Altman right now?
The robotic surgeries that we do, we can basically break those down into specialty. My specialty, general surgery, we do inguinal hernia repairs or groin hernia repairs. We do ventral hernia repairs or abdominal wall hernias. I'm doing colon resections robotically. We can do gallbladder removals robotically. Really anything from a general surgery standpoint that we are doing open or laparoscopically, we can do robotically. I have a colleague who's a surgical oncologist who does very complex pancreatic resections and liver resections robotically. Our urologists are removing prostates, kidneys, doing some very complex things robotically. And our GYN surgeons have continued to do both benign and malignant hysterectomies robotically. The cardiothoracic surgeons are removing lungs. They're having the robot assist in harvesting, vessels for coronary bypass. So it's really a very comprehensive platform.
So, in your 20-year career, how many robotic surgeries have you performed?
I just started in December of 2016, and in that time, I'm close to about 400 procedures.
Wow. What do you tell a patient? Do you ever have patients that are intimidated by, what do you mean you're going to use robotic surgery on me? I mean, does that psychologically give them some concern?
Sure, absolutely. Yeah. I have patients that come in and ask for the robot and are very well educated on the robot. And there's other surgeons that are, concerned that I'm not actually going to be performing the operation. It's going to be a true robot that's doing the procedure. So what I like to do is I like to explain, the disease process first, and here are the different options that we have to take care of that problem, whether that's conventional open surgery, laparoscopic surgery, or robotic surgery. And kind of talk about the differences between those two things as far as recovery time, back to work, pain scores afterwards, and then really have the patient make that decision. A lot of times during that discussion, they'll make up their mind and choose what they feel is best for them. But I would say now most of my patients are choosing robotic surgery because of the data that we have that supports their quicker return to normal activities and the less pain that they have.
And I would assume that means fewer days in the hospital, too.
Absolutely.
So, that's pretty
Sometimes
interesting.
no days in the hospital for some of our complex hernia repairs. And I think, too, something that we can't ignore is, with our narcotic epidemic that we have here, we're able to get patients back to normal functioning and really limit their exposure to narcotic. Some patients are taking no narcotic at all after these procedures.
Amazing. Well, that's pretty exciting. I mean, it sounds like it's good for you for your level of precision. It's good for the patient because there's less worry about complications and recovery time. So that's pretty exciting.
So what we've talked about, it's fairly obvious that you've been practicing for close to 20 years that you had to make this change. Would that be accurate to say it that way?
Absolutely.
As opposed to saying, well, I want to do it or I don't want to do it, and
Well, I think the technology's here to stay, and I think every physician has a choice to make. Is this technology that you're going to embrace, or is this technology that you're going to, watch other people use? If you look at the history of laparoscopy, when I started training, it was new technology, and a lot of the older surgeons thought it was going to be a fad, and so they didn't learn how to do that, and they saw their practices changed as laparoscopy really took hold. I was a big naysayer. I didn't like robotic surgery. I thought it didn't have an application in our community, especially in general surgery. And I kind of made fun of it, made fun of the people that were doing it, and I've had to eat a lot of crow with my colleagues, and I was wrong. Once some of the data came out that proved that it was better for the patient, I think that you have to look at your practice and what do you want to offer your patients. And I think this technology is here to stay. It's going to grow. It's going to be a bigger component of how we take care of patients.
Well, coronary surgery alone, with ripping the chest open for years and years to get in there to replace a couple of veins. Now they can couple of holes and patch it up, and the person's out of the hospital in a day or two.
That's right. I think the less you traumatize your patient, the better the outcome's going to be.
Sure. And that shouldn't that raise the age of an individual who needs surgery?
Well, I think in our...
You know what I'm saying?
Sure. Who could get surgery?
I think in our community, you have chronologic age and you have physiologic age. Mm-hmm. And I think we are very fortunate. We have a component of our population here in Stark County that are living into their 80s and 90s, and they're very, very healthy. And we're able to offer them appropriate operations in a minimally invasive fashion, which doesn't compromise their post-operative level of functioning.
Sure, and I think recovery time and all that stuff.
I think it's very important. Yeah. And I think that will, as patients are living longer and living healthier lives, I think we're going to have to figure out when is too old.
Sure.
It's a great problem to have.
Yeah. For sure. Okay, you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about the latest advances in robotic surgery. Dr. Stephen Kelly is helping us out. He's a general surgeon from Altman Medical Group General Surgery. We've got a lot more to cover, so here we go.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Memorial Day is the official start of summer. So imagine kicking your summer off behind the wheel of your new ride from Kempthorne Motors. Shop all 5 brands from the comfort of your home or on the go at kempthorne.com. Volkswagen, Mazda, Volvo, Jaguar, and Mercedes-Benz. For the summer you've dreamed of, visit kempthorne.com or see us at 1449 Cleveland Avenue in Canton. Easy, fun, and friendly. That's the Kempthorne way.
Spring has sprung at Studio Arts and Glass with our annual Garden Art Show, June 8th and 9th. Local artists fill studio with pottery, jewelry, blown glass. Watch our craftsmen create beautiful stained glass windows or make a succulent live wreath. Call to reserve your space today or just come in for the Killer La Pizzeria Brownies. That's Friday, June 8th and 9th from 9 to 8 p.m. Studio Arts and Glass in North Canton on 77 and Apple Grove.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
We are back, and you're listening to Health Matters with the Medicine Center Pharmacy. So, Doctor, are all the general surgeons at Altman practicing robotic surgery? Or?
I was the first general surgeon to start. I have other partners who have started. One of the issues is that the training is fairly intense, and so that takes a lot of time to get proficient. So you can't have a number of people doing that all at one time. You have to kind of go sequentially.
Sure.
So I was the first. I've got two other partners that have gone through the training and are now doing procedures, and I've got a fourth partner who's waiting to start his training. We've been so successful across multiple specialties that now we're actually having access issues and getting time on the robot.
You only have one. You better get some more.
We only have one. Hopefully that'll change in the near future.
Sure.
And open that access up, not only for the physicians but for patients, because some of our patients are interested in the technology and they're waiting to have their procedures done. We certainly want to offer that to them, since the outcomes are better than we've seen with open traditional surgery.
Sure. Now, excuse me. I would expect that robot has different arms or different.
It does. There are four arms, and you can attach. You have a high definition camera that is attached to one arm, and with the other three arms, you can attach a variety of instruments, retractors, energy sources, clip appliers, staplers, and you can swap those instruments in and out during the course of an operation, just like you would an open surgery, when the surgeon would ask for this particular instrument or another one and pass that back and forth. We can do the same thing with the robot.
Can the robot do anesthesia?
No. Now, anesthesia is a different component. You still have your anesthesia provider at the head of the bed administering the anesthetic. There's someone there at the patient's bedside for the entire case. There are some models for a robotic or automated anesthetic delivery system that's just not ready for prime time.
Okay.
In the spirit of that, is a surgery that's robotic assist, is it more personnel heavy, or does it take fewer personnel to maintain that particular operation?
In my experience in the procedures that I do, there's actually fewer personnel that are necessary. We still have a surgical technician that passes instruments. I still have a surgical assistant, but say for an open colectomy where I might need a lot of equipment and one or two surgical assistants, I now need less equipment, and I only need one assistant who's going to pass different instruments in and out of the procedure. For a robotic hernia, we've got our system refined where I do one instrument pass and they pass the mesh on the inside, so it's a pretty streamlined, efficient way of doing things.
So I don't want to reach too far, but I would think that means fewer people, fewer instruments, lower risk of any type of cross-contamination based on having more people and more instruments in there. Would that be fair?
I think that's in theory absolutely true.
Very interesting.
I've seen that both hospitals have now recently installed or brought in these robotic I don't know exactly how to explain it, sterilization or the UV light, or I don't know what they are. Or they roll around on the floor or themselves or something.
I've not seen that, but in every component of healthcare, technology has taken a hold. I mean, even in in the pharmacy, we've got automated dispensers for the medications in the operating room in different parts of the hospital, and there's better tracking and better safety, and that way the patients are getting what they're supposed to be getting when they're supposed to be getting it.
Okay. So we've talked about laparoscopy. We've talked about robotic. How do they compare?
Well, in our experience in the data that we've collected, we found that the operative times are equal or, in my experience, a little faster robotically. We've seen that the patient outcomes are different from a robotic standpoint compared to laparoscopic, and this really mirrors the industry and the national trend as well. Our recovery room stays are shorter, our pain scores are better, and we're able to get our patients back to work and back to their normal activities quicker laparoscopically. Robotically as opposed to laparoscopically, and clearly robotically is far superior to return to work and normal activities than open surgery.
And less infection?
Less infection.
Post-infection?
Well, your incisions are smaller, so your risk of infection should be smaller. Our approach to the procedures is a little bit different. So if you have a big hernia through an incision that you've had previously, an open procedure goes right back through that same incision. You're going through tissue that's already been traumatized. When you do things robotically, you're doing things away from that incision. You're making smaller incisions through fresh tissue, so the risk of infection in having additional hernias is less.
So, sterilizing the parts of the robotic arm, come apart, throw them in whatever. Is that what we do? I don't.
Sure. The instruments that we use are reusable. Each instrument has a life of uses. I think most of the instruments have a 10-use life before the scissor blades start to get dull and things like that. But those instruments are clean just like any other instrument that you use during an operation or in a dental office. They go through a formal sterilization process. The machine is cleaned and draped in the same sterile fashion every time we use it.
So I guess we've kind of answered this question. Is there any other advantages of robotic surgery we haven't hit on?
I think the main things are your pain scores. I think it's a safer approach for the surgeon because the visualization is so much better. If you do an open operation, you're trying to get down to your pathology as close as you can. The robot allows us to take basically the visualization directly to the pathology. So I've got high-def 3D visualization at the point of the pathology, whereas if I'm doing something open, there's a distance. If I'm doing things laparoscopically, I only get 2D visualization instead of 3D visualization.
I guess there's a couple of components to this robotic surgery then, and one of them is high-def visibility.
Absolutely.
So, that wouldn't be possible, I guess, without that.
It's just a fantastic advantage that the surgeon has now. It's like, instead of taking an engine out of the car, you're going down to the engine and fixing the part that needs fixed.
Tearing it out. Wow, interesting.
All right, well, I guess we would be remiss if we didn't talk about risks. So why don't we touch on risks or complications that could be possible?
Certainly. Any invasive procedure carries with it risk, just like the robot. One of the biggest things when you talk about minimally invasive surgery, laparoscopic surgery and robotic surgery, is that there are cases that just can't be done that way. Sometimes you have to convert and do them in a traditional fashion, and that's based on either patient safety, anatomic considerations, or previous operations. In my experience, for just inguinal hernias, I've had to convert, I think, 2 in my series to traditional open surgery because they've had previous prostate surgery done robotically, and so the tissue planes were not clear. Couldn't do that operation safely robotically, so if you can't provide a minimally invasive operation done in a safe fashion, then you need to do that traditional open old-fashioned surgery. And that happens, and that's I don't think that's necessarily a risk. I think that's a surgeon exercising good judgment, and that's a game-time decision.
So you're sort of talking about scar tissue? Or
yes.
Okay.
Yes, so any operation is going to produce some scar tissue.
Sure.
When we do inguinal hernias, those tissue planes are adjacent to the tissue planes that the urologist will use for his prostatectomy, and sometimes there's this fusion of those planes to the point where you can't separate that tissue to do either a good operation or a safe operation. So you don't want to compromise the patient's safety or their outcome just to persist using the technology.
Okay, so you do the surgery for urology. Urologists don't generally do surgery, correct?
No, a urologist is in the operating room as often as a general surgeon.
With you, okay.
It's just we're working in usually different body parts. A urologist is usually focused on the male and female urinary tract. That's a component of my practice that's anatomy that I don't operate on.
But they wouldn't generally be trained in robotic surgery.
No, they absolutely are.
They are.
It's hard to find a young urologist who's not been trained In fact, at Altman, we're lucky enough to have a young urologist that actually did a extra year of training in robotic urologic surgery.
Cool. All right. Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we are a partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're talking about the latest advances in robotic surgery with Dr. Stephen Kelly, General Surgeon from Altman Medical Group General Surgery. Let's get back to the show. Where are we at? I got kind of lost.
Well, I think Doctor was going to walk us through a garden variety surgery.
Sure.
Is that all right?
Absolutely. So I'll walk you through what we do for an elective outpatient inguinal hernia or a groin hernia. Guy comes to the office to see me. He's been golfing or doing some lifting in the backyard, and he has a bulge in the groin. We confirm a hernia. We'll talk about the different approaches on how to fix that, and say he chooses to have his hernia fixed robotically. We pick a date. The pre-op process is exactly the same. So I'll meet the patient in the preoperative area and confirm the side of the hernia. We'll talk to anesthesia. The patient goes back to the room, and the robotic procedures are done with a general anesthetic, so the patient's completely asleep. We do some padding for the patient because we kind of put them kind of in a steep position with the head down. We'll get everything prepped and draped, and then I'll make 3 access points in the abdomen. Each will be 8 millimeters in size. So 3 8-millimeter incisions, and we slide metal cannula through the abdominal wall into the abdominal cavity, and then we insufflate, or we inflate the abdomen with carbon dioxide so we have working space, just like if you're going to have your gallbladder removed. We then dock the robot, or we basically drive the machine up to the bedside, and we connect the arms to those 3 cannula. And through the cannula, you get a camera, I have a pair of scissors, and I have a grasper. And then we fix the hernia from the inside, or from the back side of the abdominal wall, instead of the front side of the abdominal wall, which is traditional. You make a small window in the peritoneum, which is the lining of the abdominal wall, and you take that down, and you're basically looking at the hole, or the hernia. Hernia is a fancy word for a hole. You've got a hole in the muscle of the wall. We pull the things that belong on the inside back on the inside, so there's no bulge there. And then we place a barrier between the hole and the inside of the abdomen. And there's different products, mesh products, that we use as that barrier. I use a product that is self-fixating, so we basically unroll that like wet wallpaper and cover that hole. The advantage to doing things this way, or robotically, is you're able to cover not only the hernia that you know about, but the potential hernia spaces that are in that area of the body.
What is the mesh? What's the material?
The mesh is, there are different types of products. Some are woven polyester, some are polypropylene, which is almost looks like window screening, or fish line that is woven. The product I use has microscopic barbs on one side, so it sticks to the muscle. So you don't have to fire a tacker. Laparoscopic surgery, you have to fixate your mesh, and you use a tacker, which has been known to cause some problems with chronic pain. You can get nerves that get twisted up in those tacks or those screws. So I'm able to use a product that just lays up against the abdominal wall and won't shift or move.
So does it stretch with the body's movements?
It does. It does. Some patients are afraid that they're going to feel the mesh. The mesh that we use is about the thickness of that piece of paper in front of you.
Okay.
Once the mesh is placed, we close that pocket of peritoneum up so the mesh is not in contact with anything on the inside of the abdomen. From a physics standpoint, the barrier is bigger, so it helps disperse the stress of the intra-abdominal pressure over a wider surface area. That's what allows us to get our patients back to doing their normal things quicker. Once the mesh is in place, we close the holes that we've made where the cannula were. Patient goes to the recovery room, goes back down to where they started their venture, and gets to go home the same day.
All right, I have to ask, what'd you do before mesh? Did you stitch it up, or how'd it work?
Well, mesh has been the standard of care since the early 80s. Some of the mesh repairs were first described back in the mid-70s, so we still use mesh, but rather than placing it behind the barrier, there's a well-defined area from the front of the body, and we basically sew the mesh to the boundaries of that barrier. The mesh is a lot smaller, so we're able to cover less area. And if you think about it, you've got the mesh basically on top of the defect as opposed to behind the defect.
So when you push the mesh in there through the 3 millimeter hole, I think you
8
said,
millimeter.
8 millimeter, excuse me. Was it all balled up, or
no? You roll it into a tight circle, and the just like that piece of paper, you can roll and fold that paper, and you could actually probably put some of that
almost
paper
like
in
a
your
cigarette
pen.
Rolled up.
Absolutely.
Okay. All right. Man, that's
and
amazing.
that's the instrument exchange that the assistant does. He takes the scissors out, he puts the mesh in, puts a needle holder in there, so I can sew that peritoneal flap back together.
Wow.
Amazing.
It's a very streamlined,
so
very
run that
efficient
by me
operation.
again. When we started using mesh.
Mesh first described, I think, about 1976.
Okay.
Now, there have been multiple different types of hernia repairs. If you Google hernia repair, you'll come up with dozens and dozens. Some that are still done today in 2018. Some that are of historic perspective, only.
Amazing.
I told you out there I had gallbladder surgery years and years ago, and it hurts more today than it did before they took it out. But there was a huge controversy as to why it needed to be removed or didn't need to be removed. And I'm often wondering, in that day, in that time, it was a long time ago, like 40 years ago.
Sure. And I think that's a perfect example of the benefits of minimally invasive surgery. You've got an incision that's probably 6, 8, 12 inches long, as opposed to, you take out a gallbladder today, you've got a 12 millimeter incision and 3 5 millimeter poke holes. You're going home the same day, and I allow you to
That's crazy.
go back to normal activities as soon as you feel up to it.
Wow. That's amazing.
So the gallbladder types of surgery, you just suck it out, right? Would that be correct or not?
Well, you still remove the gallbladder from its attachments the same way, whether it's done robotically, laparoscopically, or open. It's just the access points are smaller.
Okay.
We oftentimes will then place the gallbladder in a little bag and then pull it out through one of those incisions, typically the incision at the umbilicus or the belly button.
It's the same. It's still the same situation, though. You have to reconnect the duct from the liver to the...
It's the same operation. It's just done with smaller incisions and smaller instruments. The actual physical removal of the gallbladder, the clipping of the ducts and the blood vessel are done exactly the same way, whether it's done open or from a minimally invasive technique.
So that technique is just still the same.
And believe
you
it or
still got
not,
to hook that thing up,
and we still have to do things through an open big incision. Yesterday I had to convert a patient from a minimally invasive gallbladder to an open gallbladder because that was going to be the safest thing for her because of her previous operations. So you have to be facile on both sides of the technology.
Okay, very interesting. Coming in on Saturdays, huh? That's really... Are you doing Sundays too?
Not Sundays yet, but if need be, we will.
Wow. Gosh, that's interesting. Okay, we're running out of time here. We got a couple minutes. Maybe we better jump to tell us a little bit about your practice and how do we get a hold of you and et cetera, et cetera.
Sure. My practice is Altman Medical Group General Surgery. Our main office is there at the main campus of Altman in the professional building. 2600.
Yeah.
We have another office where one of our partners practices, Dr. Mark Lafferty, out in Massillon at Altman West. Yeah. Our telephone number at the main campus is 453-4300. We take all insurances and are happy to see all patients.
Are you doing surgery in Massillon?
Not doing surgery in Massillon. The operating rooms at Altman West are no longer functional now. With the closure of Affinity, we're seeing quite a few of patients from Western Stark County, which is great. That's where I grew up, so I'm always happy to take care of the patients in the community that I grew up in.
Okay, so that facility is... Didn't I hear they had 60 beds there, or am I wrong? In Massillon.
At Affinity?
No, your hospital.
Altman West?
Yeah.
There are no inpatient beds there.
Aren't there? Okay,
no.
I guess I'm...
No, there's a physical therapy, stat care lab, and some physician offices.
Okay, gotcha. All right. So you haven't been able to pick up a whole lot from Affinity closing then over there.
I think that our patient volume, seeing patients in the office, certainly has picked up, I think, throughout the community.
Okay. Well, our very special guest we're talking with today, Dr. Stephen Young, General Surgeon from Altman Medical Group. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass, Kempthorne Motors, Kiko Auctioneers, and, of course, our technical producers, J.D. Angelis. As always, we thank you for listeners for joining us on Health Matters with the Medicine Center Pharmacy. We're a local Health Mart pharmacy caring for you and about you. Have a healthy week. We'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com.